I think that's what she was waiting for, was to, so the recording could start. So I think, yeah, I think you're good, Pat.
Okay, well, we're called to order. First, first thing on the agenda is public comments, and Kelsey said earlier there was no one signed up, so nobody since then.
And we don't have anybody on that is participating. Let me double check that.
Okay,
Nope. So we don't have any public either signed up or attending the meeting right now.
okay. So we'll close the public comment session. And the first agenda item is a update on guidance. Ashley.
Hello, everyone. So here I am again. So over the holiday break, Christmas week, we had CDC guidance that was updated for general public isolation and guidance. And then 2 weeks later, they were able to get the K through 12 guidance updated. And so CDC has formally updated all of their isolation and quarantine guidance. So we have plugged that into our current K through 12 school and daycare guidance. So that is what is in front of you. Since we sent this draft, there were a couple of clarifications that we've been able to iron out on our end. And so I won't go through all of the general recommendations, but I do want to just mention that there are still a subset of individuals in K through 12 that would still be required to do a 10-day isolation and a 10-day quarantine instead of the 5. So those populations include children under 2, because that is the population that cannot mask. Individuals with extremely severe illness, and then people who are immunocompromised. So though that immunocompromised and the severe illness populations, those are individuals that the CDC historically had said you need to isolate for 20 days if you get sick, and they have now bumped it down to they can isolate for 10 days or quarantine for 10 days, and then general population can isolate and quarantine for 5 days. So I'm happy to answer any questions if there's anything that we need to go through to kind of get into the weeds. But again, it's a kind of a run-of-the-mill, take it from CDC and plug it into our guidance.
Actually, the document that was mailed to us, is that the highlighted portions are what has been changed, or?
Yes.
Okay. And or the blue, there's a blue.
Let me pull it up just to make sure I'm telling you the right thing. So there should be, for the text, there should be red strike throughs. It was basically just provided to you in track changes. Stuff that is in blue, I believe that those are links. That's what I'm seeing. There are some links, but then there's some headers that are blue.
And there's some, it says green, like update December 2021, update January 2022.
Yep. So the green is actually also a link, but because it's in track changes, it's showing up in green. So those are some updates too.
I really appreciated having Kathy's perspective on this, and so thank you for sending that to us.
Yeah, did you get that, Dr. Gates? I didn't get that out until about.
I think it's very helpful. Very helpful.
Yeah, Kathy said that it's working very well. You know, that they're able to fulfill, you know, the requirements, and that it's been working really well. The issues that they've had is that they just don't have the staff to do the tracking, but otherwise they've been able to follow the direction, and it's been very helpful.
I don't have any questions.
Neither do I.
Dr. Gates, you don't either?
No. Are you able to hear me?
Okay.
Yes.
Yep.
Thank you, Ashley, for your help.
Yes, thank you.
Yes, it's very well done.
Thank you.
All right. Then Gary, the 2022 legislative session.
Yeah, so this will also be relatively brief. I just, the new firm that we have for Mosifi really does an outstanding job. And so I'm sending you their updates. When I get them, I forward them to you, so you have the latest updates. However, we did have a legislative committee meeting at 3:30 this afternoon, so I can give you a little bit more. And then when the actual email update comes out tomorrow, I'll be, of course, forwarding that to you as well. But basically, if you haven't been following the legislature, they've been focusing their time on redistricting and then also budget type things, trying to get those things in order. Those are the top priorities. Interestingly enough, this week, a lot of committee hearings have been canceled because of COVID. So there hasn't been a lot of activity this week, except for, pardon me, except for as it pertains to public health, there's been an extreme amount of activity on immunization bills and vaccine exemptions. There seems to be a great emphasis on that with the legislature to make it easier to exempt people to opt out of vaccination. That's clearly very concerning. It's focused right now, obviously, on COVID, but the concern is that if they set this up in a manner that would allow for this to be extended to childhood immunizations like measles and mumps and MMR and polio and other things. So we're concerned about the COVID issue driving this to a bigger problem, and so
Yeah.
the unintended consequences of that. So we're watching this. We're watching this very closely. There are a number of bills, as there always are, multiple reps and senators file bills, and many of them are the same, and then they have to get together and work together to try to pare it down to one or two that is acceptable to everybody. So, but the concern is there's a lot of activity and energy right now for this very early on in the session, and so just wanted to give you that heads up that's out there. They're really wanting to expand religious exemptions and just an ability to say no based on personal beliefs. And so I'm not going to spend a lot of time in our meeting tonight talking about that, but again, the basic concern is setting the table for more far-reaching and sweeping impacts on childhood immunizations. So we're watching that one very closely. The state has not determined how they're going to distribute the ARPA funding that they're getting from the federal government, and the reason for that is they're waiting on guidance from the federal government. Apparently, they haven't gotten any guidance yet out from the feds to the states on how the states are supposed to, what's eligible and how to spend it and all of those things, incredibly. So they're waiting on that. So any ARPA funding from the state is currently on hold. And according to the legislative liaison report this afternoon, they're wanting to have as much flexibility as possible when those funds are released to determine where they want to spend them. So that's kind of it's a wait and see kind of a proposition right now because they haven't received guidance from the feds. And so that's really the legislative update for an activity for tonight. Like I said, we just had this meeting at 3:30, so that's basically hot off the press news. You'll get the full update as usual as soon as I get that, and I'll send that out to you. So it's interesting to say the least, and so we still have major concerns about all the pre-filed bills that were attacking Board of Health Authority and Health Department guidance, especially around the control of communicable disease. So more to come. Any questions on the legislative brief?
No, thank you for the update.
No.
Yep. Okay.
All right.
Sorry,
Board
one
of
thing.
Trustees oh, go ahead.
Sorry. One thing. I do want to inform you also that I received an email yesterday afternoon after 5 o'clock. So I contacted Brian this morning. It's too late to have put it on the agenda, so we can't discuss it. But I just wanted to let you know that St. Louis County has reached out to any and all health departments who want to file an amicus brief on the appeal for the ruling in Cole County. They're inviting anyone to do that. An amicus brief, if you don't know, is friends of the court. And what that basically means is that if there's in an appeal process, if the court rules for allowing amicus briefs, it basically means even though you're not a part of the suit, you can come forward and say, yes, we support this, we agree with this, and here's why, kind of a thing. So it's a legal opportunity for your voice, in this case, for your voice to be heard in support of the appeal of the ruling against local health departments and the state health department, which was what the Cole County judge did. So we can't talk about it because I didn't get it on the agenda, but I'm just letting you know that I received that request and more to come.
Gary, so no action can be taken, no discussion
No.
until the next board meeting, is that correct?
Unless we have a special board meeting.
Okay.
Yeah. So Brian advised me that you can tell them that you got it, but you can't talk about it.
Thanks for letting us know.
Yep. Okay, sorry, Pat. Now I'm good.
Next thing is Board of Trustees self-assessment. You're up again.
Yes, so thank you. So first of all, thank you everybody for filling that out and doing that self-assessment. I've sent you the copy. It should have been in your packets. I believe it was. So you have the results. And so what we need to do, what you need to do, and Pat, you really need to lead this conversation, not me, but really need to go through and highlight the anything in there that the appropriate the board wants to talk about or whatever. And then at the end, there was an opportunity to list the 3 to 5 priorities on which you believe the board should focus its attention in the next year. And so if you just go through that and really the amount of conversation and the depth is up to you guys. And then in terms of the, I mean, you've done this before multiple times, Pat, so you know the drill. But and then you get to the comment section, and my job was to distribute the survey, compile the results, and then get it back to you all for your review and discussion. So I'm just setting the table, and so Pat, if you just want to go ahead and do your thing.
Okay. All right. Well, it starts, the first section is board responsibilities. On that section, everyone strongly agreed with the statements that were put in there. So I'm going to go to the next section unless somebody has a comment on that section. Board structure. The board is diverse and representative of the community. We had 2 strongly agree and 2 agree. And the board has active and functioning committees as needed. There were 3 strongly agreed and 1 agreed. On the diverse and representative of the community, we've been for years trying to get more of a diverse board.
Pat's frozen.
There you are.
You know, when there is, yep, yeah, I don't know what it did. It buffered, I guess. Other than when there is an opportunity, trying to get someone, you know, and that diversity can be that it's from another part of our county. It can be cultural diversity. You know, I mean, diversity is pretty open. Yeah. So, yeah, there's not much that we can do at this point with the current board for that. But it's something to keep in mind so that when an opening does come available, if you know someone or, you know, you can recommend someone, then that we want you to do that, or to encourage those people to sign up to run, so that, you know, we do get that diversity. And present board, what we can do is keep in mind, you know, that we do want to include diversity in our discussion. We want to include diversity in our decisions, and, you know, make it as open as we possibly can.
Pat, can I interject here for a second?
Sure.
So, sorry, just to let you know, ever since we've implemented this this tool, this comes up every year, and the biggest challenge, which I think has been alluded to, just to reiterate, is the fact that this is an elected board in a nonpartisan election. This is not like a not-for-profit where you get to pick and choose who you bring on. And so the Board of Trustees is a nonpartisan election open to anyone who's a Clay County resident over the age of 18. So it's just, I just wanted to put that perspective in there. Thank you.
Thank you. The second one about the functioning committees, Dr. Gates, you might not know this because you haven't been on very long, but because there's only 5 members on our board, we really have not had separate committees that, say, each of us belong to. But throughout the year, when subcommittee is needed, and we've used those for, like when they evaluate, when Human Resources evaluates the benefits package, and they're looking at insurance carriers and that sort of thing, then we've had 1, 2, or 3 people off of the board, depending on who wanted to participate, meet with that committee and work through the process with the HR people and that committee for benefits committee. And, you know, so as a board member, if there's a need for a subcommittee, I can volunteer, or I might be tapped on because I have the experience in that particular area or something like that. So we do have an occasion to have a subcommittee where a board member does participate. We don't have standing committees that the board members are part of. So just for your, for your information and so as we go through, if we have something that comes up, you might want to participate with that. We'll let you do that. The rest of that board structure, everybody strongly agreed with the questions that were on there. Board leadership, everyone strongly agreed with that. And board practices, everyone agreed with that section. Board meetings, the only one that we had that not everyone strongly agreed on was board members come to the meetings prepared and actively participate in discussions. And we had 3 strongly agree and 1 agree. As part of our board membership, as part of our responsibility, when we receive our packets, those are sent out ahead of time so we can go through them, we can review them. And anytime that you have a question on something, you can call Gary and ask him about that even before the board meeting. You don't have to wait for the board meeting. But, that way, when we do have our meetings, people can participate if they've prepared, if they've, read the materials, they've reviewed everything. So that's where our discussion piece comes in, that, we're able to say, well, we like this, we don't like that, we agree with this, or we don't agree with that. Board culture, all of the questions, board members work well as a team. The board has a climate of mutual trust and respect. Board members accept assignments and carry them out in a timely manner. All 3 of those were 3 strongly agreed and 1 agreed. That's something that we can work on, and that we hope as we progress during the year that we do, get everyone to gel as board members and do get that mutual trust and respect. Gary?
Yes, I just wanted to also, for context for the board, it's important to recognize that and this is great discussion, but it's also important to recognize where if you had somebody that strongly disagreed on any of these categories, that's really where you dive into,
Right.
okay, what's happening here? Why do we have 3 people strongly agree and then 1 strongly disagrees? I mean, there would be an opportunity for that. So that's the good news is you don't have that on this document, but
Right.
sorry, I just wanted to point that out too.
And that's accurate, but having 1 person who agrees and we have 1 person who did not make a judgment on that. So, also because there are 5 of us and 3 and 1 only adds up to 4. So those are areas that we can work on, though, to make sure that everybody feels like a team member, that we're working as a team, that we do have that mutual respect and trust. And that comes over time as we work with each other, so we'll do that. Additional considerations, everybody agreed with all of that. So then.
And sorry, Pat, can I tell you one more thing? Sorry.
Sure.
So on the comments received, I just wanted to let you know this before you dive into them. What I did was, these aren't in necessarily any priority order. What I did was I took the first response from each board member and then I put that under 1. And then
okay.
each board member's second response, I put that under 2. Same thing for number 3. So this doesn't mean that any one of these have more priority or weight than the other. It was just that was the sequencing I did when I collated them.
Okay. Before we look at at the comments, I have one question, and that would be if either of you have any suggestions or recommendations for any of the questions, the way that they're asked, you know, the way that they are presented, or is there something missing that you would like to see in the assessment? Because we have the opportunity to change the questions if we want to, or to add questions, delete questions, that kind of thing.
I don't have any changes to it.
I think these are good questions and they bring good discussion afterwards. So I think they're good.
Okay. We have changed a few things in the past, so maybe we're getting there. All right, so the number one priorities for people were adding staff to provide and expand service coverage based on population, address school safety, such as evaluating screening for weapons of all persons entering school buildings, whatever is needed to address the pandemic, and reaccreditation, participating in the success of this process. So those were the number one priority.
Nope, they weren't the number one priorities. That was the first answer on everyone's.
Oh, the answer. Got you. Okay,
yeah.
So, exactly. Okay. So we can't assume it was the priority. It's just the number
Correct.
one answer. Gotcha. Gotcha.
Yes.
Gotcha. Gotcha. All right. Second was continuing to provide quality services related to COVID, reviewing the role of the Board of Trustees of local health departments into policy decisions made by committees, organizations of local public health directors, furthering our partnerships with schools and organizations. Policy and direction of Clay County Public Health Center reflects the priorities revealed in the CHIP and CHOP. And then the third comments were maintain and build on accreditation and community involvement, become involved in the development of Kansas City Healthcare Department policy proposals prior to its presentation to the Board of Trustees for an up or down vote, continue seeking grants, funds to help with programs and replenish reserves, continue to support and guide pandemic efforts. So of all of those comments, what would you like to see as the number one priority? And this, what we're setting is what we want to focus on for the next year.
There were
Well,
several. Go ahead.
Go ahead. I think that, you know, the pandemic was brought up, and that's probably the elephant in the room. So probably everything's kind of pandemic centric, but and then there's mention of schools and our relationships and trying to help with schools in a number of ways, which that overlaps there too.
Yeah, we all kind of hit on, you know, similar things, which is good. I guess the other part of it would be accreditation in that process.
Well, and I think that particularly is a focus this year because we're going through that process for reaccreditation, you know, for right now. So I agree that is a piece that we have to focus on.
And I'll also point out that even in this conversation that you're having, and you end up saying, well, let's focus on these three things. This is not a hard and fast rule, number one. Number two, it's not a hard and fast rule. It's suggested guidance. Number two, it doesn't mean that anything else that was brought forward, if it doesn't reach the 1, 2, or 3 number, that it just goes away. So, you know, everybody's communicating what their thoughts are. And so I just think it's important to recognize that maybe on an individual basis, if you it's not your one or two or three thing, it doesn't mean that it goes away. I think it's the board's responsibility to keep those thoughts in its front view, if you will, as you go throughout the year.
And a good example of that is in the grouping of number 3, continue seeking grants and funds to help with programs and replenish reserves. You know, whether we put that as a priority or not, that's going to continue because that really is a necessity and something that staff work on continuously to try and help maintain the funds coming in so that we can do the things that we need to, because we can't rely just on the tax levy, and we can't rely on federal, you know, the federal funding that comes through. We do some contracting with the state, but even that has, those funds have lessened. And so we're not getting as much. So staff have been given, you know, the opportunity and been told, you know, we need you to be out there looking for opportunities that will bring money into us, whether that's a grant, whether that's, you know, a partnership, you know, whatever those things are, they're working on those all the time.
Mhm.
So I think it's kind of a priority in and of itself within the system, as opposed to us saying, okay, we want to really do this. And several years ago, we sort of changed a focus, or changed and said, hey, we do want to look at grants and funds outside of our tax levy, outside of our contracts with the state, that sort of thing, because we knew that money was going to be cut and that we weren't going to be receiving as much. And so we've been doing that for several years, I think. I don't remember exactly when that switched, Gary, but it's been
Yeah, well,
like
that's
4 or 5 years ago.
yeah, I was gonna say 5 for sure, at least.
Yeah.
There was an entire meeting, well, not an entire meeting, but a lengthy discussion at a meeting about operational sustainability.
Right.
And that got put into our strategic plan, as a matter of fact. So, yeah.
So that's a good example of, you know, yes, it's brought up here and we do keep it in mind, but it is something that's built into the system at this point too.
Yeah, that's good.
Pat, I like that the final entry on number 3, continue to support and guide pandemic efforts. I think that pretty well covers a lot of the
Yeah.
others. Kind of like that. the way-
Stated very well there. And unfortunately, right now, the pandemic is kind of leading us and what we need to focus on, what we need to address.
Yeah.
That's a pretty large part of it.
Yeah.
I agree.
Well, I found some of these really interesting. It's just interesting to see, you know, what the other board members have put out here. And so I didn't think about addressing school safety as a health issue, you know, but I guess that it is kind of a health issue.
Yeah,
It could very well be.
you know, I think it isn't a problem until it is a problem. And, you know, I think sometimes getting ahead of things before we're all about preventive health and preventive things. And the question is, you know, what is the mission of the health department, and does that include that? But truly, it's a safety issue that we see when it breaks down, it's terrible. And so I don't know. I think it probably fits into the public safety situation, and we've developed some very good relationships with schools going in the past few years, and this might be something that reaching out to them and seeing if there was any role for what we could do or help with in a preventive fashion.
Yeah. Yeah, that's wonderful.
Right. Yeah, I'm not sure that as a health department, we could, you know, we could support them with recommendations of how they could provide safety. But, we're not going to be the ones saying, okay, you have to screen everybody for weapons. That's not
Yeah.
going to be our role. That's going to be the board of the school board's role to decide if they need to do that. But as safety, and not just weapons, but other things that happen in schools that come under that safety umbrella, we could do a policy statement, or we could do a paper, suggesting approaches to safe school environment, a safe school environment. But that would probably be the best that we could do, other than, like you said, working one-on-one with a school if they have something that we could assist them with.
Yeah. It's good to think about.
All right, so kind of looks like and sounds like the three main themes that we have here are the pandemic, continuing to support and guide the pandemic efforts, working with schools to address whatever issues they're having, and that we can participate with to provide a safe environment and a healthy environment for them.
Yeah.
And then, continuing to participate in our reaccreditation process and making that a success. And a lot goes into that. And a lot of what's on this list, the people who are looking at the reaccreditation, they're looking at these things also, because the accreditation, it's kind of like the hospital accreditation, like Joint Commission. These people are very much like that, and they're very detailed and very in-depth in how they evaluate a health department, and how they require us as the health department to prove that, yes, we do achieve what they're looking for. We can't just say, oh, check off here, yes, we do that. We have to show how we do that, and we have to show how it was started. We have to show what policies we have. We have to show how it's implemented. We have to show how it's evaluated. We have to show how it's revised if it needs to be revised. So it's a very in-depth process of accreditation, and takes a lot of time, doesn't it, Gary?
Sure does. Our staff are fantastic. They've really embraced that fully, and yes, it's quite an accomplishment. And so yes, I would agree.
Well, being accredited, when we started the accreditation process, since we've started that, the changes in the health department are dramatic, because we now have human resource policies that address things that we didn't address before. We have evaluation processes for our staff that are very goal-oriented, performance-oriented, performance-based. We didn't have that before. So the health department has changed a lot based on accreditation, and it's been for the good. It's been much better since we've been doing that. So it is very important. All right, are you comfortable with those three areas of, that's kind of where we want to focus? We don't want to forget anything, but
Yeah.
okay. And you don't want to change anything this time around, huh? All right. Courtney, treasurer's report.
It's me. I'm up next. Okay.
Yes.
So you guys had your financial statements and the balance sheets and the revenues and expenditures and the, does anybody have any questions over any of these reports that we have in front of us? The notes that I have here to share, the revenue for December was $200,797. Year-to-date revenue is $7,987,463. We have received approximately 88% of the budgeted revenue. Expenses for December were $332,637. Year-to-date expenses are $8,574,342. We've spent approximately 95% of our budgeted expenses. Again, the COVID-related expenses have caused the medical waste, professional and contracted service, janitorial, and rent expenditures to be higher than budget. So that's what we're seeing there.
Yeah, due to our COVID.
Yes, yeah. Okay. Well, with that, I'll
And
take
we
a,
have some investments, don't we, that we need to
yes, thank you. Okay, let me get you those.
vote on also.
Yeah, so we have 2 that will be redeemed this month. And then there are 2 others that are available for us to purchase this month. And then there are 2 others that are going to mature next month.
And we've received that 88%. The other 12% probably are challenges that we may or may not see, you know, depending on how those go. If someone has challenged their taxes, then we don't get those until after they've gone through that whole process of challenging.
Okay, thanks for explaining.
All right. Any questions, Dr. Gates?
Courtney, on the, when we invest any funds into the banks or, you know, investments that we make, do we take into account domestic versus foreign investments in the sense that investing in America, or what are the things that we look at when we make these investments? I see investments in India and but mostly in America.
Yeah, I think that's Indiana. Is that right? No. Okay, I'm sorry, I'm wrong. And Gary will be able to answer that better than I will.
Yeah, so the answer to your question is yes, we do. We actually are in consultation every week with our Commerce Bank advisor. And so Penny works with that advisor on a weekly basis to determine this schedule of investments. And so it varies as to month by month what the best rates are. But yes, it's the majority of it is in the U.S. And these banks also have offices in the U.S., even though it says like State Bank of India, for example. So, but that's who we work with, Commerce Bank, and that's on a regular basis. We get weekly reports actually daily reports on the progress of investments, as well as what the market is doing. You know, we can't invest in the market. That's prohibited, but
Right.
Actually what we can invest in is pretty limited by Missouri statute, so, and laws. So, but yes, we do. And his name is, I can give you his name if you're interested, but he's the person that Penny works with at Commerce Bank.
Yeah, I just, you know, I see folks out of work, or, you know, the economy in America down, and I think it's always good to try and to keep things
absolutely.
in America.
Absolutely.
Yep, absolutely.
Agreed.
Good questions. Any other questions?
No.
For Courtney? Dr. Gates, since there's just 3 of us, you'll need to make the motions on these, and I'll second them for you. But
Okay.
we'll need a motion for to accept the December 2021 financial statement as presented.
Motion to accept the December 2021 financial statement as presented.
I'll second that. Any discussion or questions? Right, hearing none. All those in favor?
Aye.
Aye.
And then I need a motion for the to accept the December 2021 schedule of investments as presented.
Motion to accept the December 2021 schedule of investments as presented.
And I'll second that. Any questions? Discussion? All those in favor?
Aye.
And then I need a motion to accept the consent agenda. If you
I'll
would,
make-
Dr. Gates. You can't do it,
Second.
Courtney. It's got the,
Shoot.
it's got the financials in it.
Oh, I see.
Okay, motion to approve the consent agenda as presented.
I'll second. All in favor?
Aye.
Aye.
Courtney can't make a motion on anything related to the finances since she's the secretary, or since she's the treasurer, sorry.
That makes sense. That makes
Yeah.
sense. Now that you say it, I'm like, yes, okay.
Yeah, yeah. Keep you good. All
Thank-
right. Next item is new business. We need to vote. We need a motion to accept the Board of Trustees self-assessment as presented.
So moved.
Second.
Any questions or discussion on what we went over for that? All right, all those in favor?
Aye.
Opposed? All right, then I need a motion to approve the revised school guidance as presented. School guideline.
A motion to approve school guidance update.
Update.
Yes.
And I'll second.
All right, any other questions on that or discussion?
Glad it's working.
Kathy says it works well, so we hope it stays that way. She did comment that she knows there's a higher incidence right now, but they have really not seen an increase in cases related to kids in school. So, you know, she thought that was a very positive thing.
Absolutely.
All right. Any questions or discussion on that? All those in favor?
Aye.
Opposed? All right. Then each month we look at continuing the emergency reserves for COVID activities. And it's still on here, so they're still requesting that, you know, they have that opportunity if they need to use the emergency funds to do that. So I need a motion for the continuation of emergency reserves for COVID activities.
Motion to utilize the emergency reserves for COVID-19 activities.
I'll second.
All right, any questions? We hope some month we're not going to have to do that.
Yeah, so we're looking forward, and I was going to talk about this briefly in my report, but I guess since it came up, I can do it now. We are in the process of applying for ARPA funds from Clay County Commission. So if we are fortunate enough to be successful in that, that should take us to the point where we don't need to do emergency reserve as a contingency to supplement our expense. But that'll be presented this month to the commission. And so that's why this is on the agenda for now, because we don't know whether that'll be approved or not.
Yep.
And so we just need to continue. We'll probably have a much better idea in February at the board meeting as to what the future holds on that.
Good, good. All right, I have a motion then to continue the use of emergency reserves for COVID activities. All those in favor?
Aye.
Aye.
Opposed? All right. Monthly management report. Ashley, you're coming back to do that?
Yes, I am back. Daryl is out, so I am going to help him out here. So we have just some highlights that I have pulled out of the BOT reports. I'll run through them quickly for you. So of note, I wanted to pull your attention to the communication section. I'll work through the document. So the end of year notable stats, I wanted to throw out there that we've had 1,470 posts created and published. The number of times that the content was displayed to users was it's a really big number, 300,000. 300,000. So that's down from 40% from 2020, and then the number of times that users engaged, 200,000. That's down from 59% from 2020. Moving on, we did have roughly 500, almost 530,000 visitors to our website. We had just over 1 million page views for 2021. We had 161 different news stories that CCPHC was either mentioned or was about us at some point. And I think that's it for communications. Moving on into the operations section, we have a report here. I'll just draw your attention to the safety committee activities. In 2021, we did have a total of 15 incidents reported, so that's fairly in line with what we had been seeing previous years. In accounting, Gary has already mentioned this, but we are prepping for the ARPA budget for 2022, and we are also preparing for our 2021 audit. In terms of IT, we've implemented new firewalls for the network security, and then we also carried out agency cell phone upgrades. And for under our client services and records, for the 2021 vital record revenue report, the total revenue was $286,169, and then the budgeted revenue was about $220,000. So we were above what we, yeah, we projected there. And then moving on to the HPP section. So in December, DCI staff continued to follow up on cases and contacts. At the end of December, we were at about 140% above capacity. We're currently sitting at about 330% capacity since this came out.
Ashley, could you clarify to the board what that means?
Yes, so we monitor like the number of cases that come in versus the number of cases that we can actually investigate. And that actually goes into, we have some metrics posted on our recovery dashboard that helps inform, but if we don't have enough staff to investigate all the cases, we essentially have a misbalance. So right now we are the 330% above capacity is meaning that we're closing out most of our cases to surveillance and we're not able to investigate them. Does that help, Gary?
Sure, thanks.
Yeah.
Ashley, are you getting a lot of people calling and self-reporting now?
So we have posted on our website, we have a form that people can fill out for their at-home tests. We do still get people who are calling in and they'll say, well, I tested positive and I haven't heard back from you. And we just can't get to everybody. And so if we have them on the phone or if we're able to connect with them, we will still offer them guidance, but it's not us pursuing the investigation, if that makes sense.
Yeah, so
are
I just
you seeing a big increase in the number of people who are filling out the form and self-reporting?
So that form, we just posted it last week, and I have not gotten reports on how frequently it is being used yet. We don't actually investigate the at-home tests that are coming back, just so everybody is in the same space. So we have different definitions for our cases, and if somebody has an in-home test, they're a suspect case, and we don't actually investigate them. So it really is just an avenue for people to communicate if they would like, and then we can send them information through email or whatever on how to determine their own isolation and quarantine, because really that's a lot of times what they're looking for is, hey, I have this positive test. How long do I have to stay home?
Right. And then are you including them in the numbers for your total cases, or you don't?
The at-home tests, if you're positive with an at-home test, you're considered a suspect case. On our numbers that go onto our dashboard, we report confirmed and probable cases, but not suspect cases. Sorry, Gary, you're trying to add something there.
Yeah, well, I just want to take advantage of the fact that you're at the meeting tonight, Ashley. So while we're in the epi section part of the report out, could you briefly, for the board, provide a frame of reference as to what's currently happening? You talked about the 330% capacity issue. What's driving that? It's the number of cases. I'm going to put up a graph later, but okay. I just thought since you're here, can you talk about what's happening with the Omicron variant and what's happening in our community with cases and all? Just a brief wrap up of that.
You want the full enchilada? I can give that to you. So, recently, over the last couple of weeks, we have just seen an insane amount of cases reported. We are seeing double the cases reported weekly that over what we were seeing last November and December. And so there is just absolutely no way for us to have even to be able to be prepared for this surge. So right now we also, we take case reports, but we also have several different other mechanisms for surveillance. And there is a sewer shed study that we monitor, which basically looks at stool samples or wastewater samples from throughout the state. And that study is able to determine what percentage of variants are circulating in the area based on the wastewater samples. So right now we are seeing like a 50-50 Delta Omicron is the most recent report that I saw. So Omicron is absolutely here. It's been here for a couple of weeks, and as soon as it got here, it just exploded. And so what we're seeing is relatively mild illness for the most part, but because there is just so much volume, statistically, you're going to have cases that are more severe. And so that is the driver behind the increased hospitalizations and our hospitals, wanting more action in terms of masking and immunizations. And so we have 10 FTE for our disease case investigators, and this just came up so quickly that we didn't have the opportunity to scale up really. And so that is the same capacity that we've been working with essentially since this summer. We were managing just fine up until this surge. And so we're trying to kind of recalculate how we manage COVID. And we're trying to build in some additional infrastructure to get some team leads for those DCIs, because scaling up and scaling down and doing it quickly has been a real challenge. So
thank you. Yep. So just to encapsulate all that in a sentence, the public health system, which includes the public health departments and the hospitals and the physicians and everyone, right now the public health system is overwhelmed.
Yes.
Okay, thanks, Ashley.
One word, overwhelmed. What's that?
Hang in there.
We're working on it. So in our extra time, we did apply for a grant through NACHO. We were awarded this grant. And so we will be working with skilled nursing facilities to increase their infection prevention capacity for COVID. And then just as a side, we have also been seeing an increase of influenza activity, in particular that influenza A. So we've had about 300 cases reported thus far for the flu season. And then I will just note that we've had about 12,000 cases of infectious diseases reported annually for just this year, and that is at least double what we've seen any other year. So our capacity is really stretched. In terms of our health equity program, so we have hired a health equity program manager. That individual will start on January 24th. So just so everyone is aware, we took the community development program and we've expanded the community development program. And so now the health equity program will encompass the community development program. So this new manager will oversee community development, and then we also have a policy program that we're going to develop under that program. So that is a different program header from what we've seen in the past. And then let's see here. In terms of emergency preparedness and response, just as an update, the contract with Heart to Heart that we were utilizing to immunize our vulnerable and diverse communities, that contract ended at the end of December. So CCPHC has opted to take over that activity, and we will be going out in, well, this is a little bit later in the report, but we do have some community events that CCPHC staff have coordinated for January. Curative is a third-party vendor that reached out to us and wanted to work with us to conduct testing events in Clay County. And so we've been working with them to coordinate those community events to increase that testing capacity in the community as well. And then moving on into, well, I will give an update on accreditation. So we do have another deadline through FAB to turn in additional documentation at the end of January, and we are hoping to have a virtual site visit scheduled sometime in March or April. And then moving on into environmental, it looks like for 2021, we had 1,463 food establishment inspections. That is routine and reopening. And that is about 500 more than we had in 2020. So growing businesses there.
They were all closed in 2020.
Not for the whole year, but yes, you're right. So thank you.
There was a period of time when everybody was closed.
They were, yes. All right, and then let me just see what the next highlight is here. So moving on into community health promotion section, under immunizations, the Missouri DHSS did conduct the VFC recertification. There was a site visit in December. There were no compliance issues that were identified, and We just note here that the spring 2021 school-based immunizations will be suspended so that the immunization program can focus on resources for those COVID-19 offsite vaccination efforts. We continue to offer the COVID-19 vaccine at our main location Monday through Friday, offering about 45 appointments per day. And then it looks like planning is underway for several offsite clinics, but then also we are working to conduct Saturday clinics and after-hour clinics in our own building. And I believe that is it for, oh, I lied to you. There's a WIC highlight. Okay, so under WIC, they are moving forward in assessing the needs of the North Kansas City children and family that are served at the North Kansas City Early Education Center. So these families were asked to complete a survey that assessed whether they would be interested in participating in WIC at that location. And so far, they've heard from about 50% of those families, and almost 25 of those families indicated that they would be interested in WIC appointments at that location.
25%.
Yes, sorry. What did I say? 25%.
Yeah.
Yes. And I'm just making, yep. And so that is it for the highlights that we were wanting to throw out there. Any questions?
No questions. Thank you for the report.
All right, Ashley, thank you. Gary, your director's report.
Sure. So I've already talked about the legislative update, and I selfishly had Ashley give the majority of the COVID update for you. Figured that would be very helpful. So thanks again, Ashley, for that. I will show you the current, if it will pop up for me. So are you all able to see this?
Yep,
Yes.
I'm probably gonna lose power, so I'm gonna drop off pretty soon.
Okay.
Sorry, I can't get any of my charging blocks to work.
Okay, all right, thank you. I think we don't have anything else to vote on anyway, so.
Okay, good. Well, I'll just listen through until it goes off.
Okay, so
All
as you see on your screen here, this is from our Data Hub, which is our public accessible website. And you'll see on the screen here, we've been tracking this since the very beginning. So you'll see the first wave here and then the second wave, and then you'll see a radical jump. And this is what Ashley was referring to. And this will get updated tomorrow, so we'll add another bar to it. And I already know in talking from our staff this morning that it's going to be even higher than this number. But I want you to pay attention to this here. This is what's been happening since Thanksgiving and Christmas and New Year's Eve. This is a direct result of those three holiday activities and the Omicron variant and its impact. And so you'll see that we are at, as Ashley mentioned, we're over double the number of cases that we've had per week as anytime during the entire pandemic over the last couple of years. So a lot of times I'm a visual person, and so a lot of times just having the visual is more impactful than telling you what's actually going on. But you can see right here, this is what's happening right now, and this is why the hospitals are stressed. Our public health departments are stressed. It's significantly higher, and I know Dr. Gates, as a hospitalist, can certainly speak to the direct impact that that's having on him and his team and staff at the hospitals locally. So I won't go into all that, but I did want to highlight this particular graph to illustrate what the problem is right now. So anyway, Again, that's on our public facing dashboard. And so really that's kind of all I have, because we've done the COVID and the legislative, and those were the two big things. I expect the CHA to be completed within the next several weeks, and then we'll be moving directly right on into the CHIP, which I expect will also be our target date is by late spring, early summer to have that done, and then we will then engage into our Clay County Public Health Center strategic plan process, which you all will be actively involved in, and we'll be basing that, of course, off the CHA and the CHIP, and that data and those priorities for our communities. So it's going to be a busy year for us, and as Ashley already alluded in her report and Daryl's report, we are anticipating having our site visit from FAB sometime in the first half of this year. The submission date for all the documents is January 27th, which is going to be here in about 7 days. So once we send that off, then they'll do their review there, and then we'll be notified of a site visit, and I'll keep the board, of course, apprised of when that will be. So between the legislative session, between the CHA and the CHIP and the strategic plan and FAB accreditation, this is an incredibly busy year. And then you throw COVID on top of all of that. So it's easy to understand why everybody is extremely busy and extremely stressed out right now. So I want to thank the board for their continued patience and support of not only myself, but the entire team here at the health center. Y'all should be very, very proud of them. They are just going gangbusters. But I gotta tell you, they're like, the physicians and the nurses in the hospitals and the staff there. We're tired. We're frustrated. We're tired, and it's very difficult. To try to sustain this for over 2 years, which is what we've been doing.
2 years today.
Yeah, it's phenomenal. So what they've been able to do, and so I'm so proud of our team. Gosh, we're so lucky, and I know you guys appreciate that, but I think it's important for me to say that so that you have that affirmation of what an outstanding job that they've been doing. So I believe that can. Oh no, it doesn't. Sorry, I caught myself this time, Pat.
All right.
In your packet, you also have the annual calendar, right? Well,
Yes.
you can't see it on my screen because of the. But anyway, so we'll be following that. But I do want to point out that the annual bylaws review will be on the February agenda. So it says January, but we're moving that to February. And then we also did not do the strategic plan quarterly review internally because it's just been too crazy. And so we're going to do that. We're going to move that to February as well. So both the strategic plan quarterly review, which will be for the last quarter of 2021, and the bylaws review will be on your agenda for the February meeting. And then the last thing, we have 3 taxing jurisdiction hearings. The first one, this is just an FYI. The first one is in Liberty. It is the Broad Acres Building 7 project, and it is a project consisting of 1,030,000 square foot industrial warehouse facility. Its total cost will be $108 million for that project. And that hearing is on January 24th. The next one is also in the city of Liberty. It is the Liberty Heartland Logistics Center, and they're expanding out at the Heartland again. This particular project is going to be industrial development of approximately 1.65 million square feet. That project is estimated to be at 133 million in costs. And so that one particular one is also on January 24th. And then the last one is in Excelsior Springs, 106 Saratoga Avenue. The hearing for that project is on January 18th. Actually, so that was 2 days ago.
Already.
Yeah. So I have not heard from our person on what the results of that hearing were, but anyway, those are the things that are occurring this month in January in terms of taxing jurisdiction hearings. So with that, I'm finished, I believe.
Well, I had the bylaws down. You'll get a copy of the bylaws so that next month we can make any revisions that we feel we need to. And, you know, as we've gone through the year, we've looked at some of those and we do need to make some changes. So please come prepared to make suggestions about what needs to be added or changed or, you know, deleted from those bylaws. But, you know, we'll review those. At next month's meeting, we'll go through and we'll make any changes that we need to. Then we will have done that annual review. Anything else from anybody?
No.
All right, I need a motion to adjourn at what, 7:25, please.
I'll make
Motion
that,
to adjourn.
I'll second.
All right, all those in favor?
Aye.
Aye.
All right, thank you. Thank you. Well,
Thanks,
Have a
guys.
good-
Thanks for all you're doing.
Have a good month.
Bye-bye.
Thank you. Appreciate you.
Bye-bye.
Bye.
Bye.